Welcome to Global Health Guide, your trusted source for understanding the biggest health trends and medical breakthroughs shaping our world. Here, we break down complex topics into simple, actionable knowledge so you can make the best decisions for your health and well-being. If you find this video helpful, don't forget to like, share, and subscribe to Global Health Guide for more insightful health stories every week. Have you ever wondered why, in the last couple of years, so many people suddenly seem to be talking about a new wave of weight loss treatments? From influencers and celebrities to friends and colleagues, names like Ozempic, Wegovy, and Mounjaro have become almost as common as discussing the weather. These medications, developed as treatments for type 2 diabetes, have quickly evolved into a global phenomenon for weight loss, a trend reshaping how millions approach their health. But the question remains, are these new treatments truly a miracle solution, or do they carry serious hidden risks? Let's explore. First, let's understand what these medications really are. Ozempic and Wegovy are brand names for a compound called semaglutide, and Mounjaro is the brand name for tirzepatide. These medications were developed as treatments for type 2 diabetes, mimicking a hormone in the body called GLP-1, or glucagon-like peptide-1. In simple terms, GLP-1 helps regulate blood sugar, slow down stomach emptying, and reduce appetite. What researchers didn't anticipate was how effectively these treatments could also aid in significant weight loss, especially for those struggling with obesity. Today, countless patients across the United States, United Kingdom, and Europe are turning to these treatments. Social media platforms have exploded with stories of rapid weight loss, some patients dropping 30, 40, or even 50 pounds within months. Celebrities and influencers openly discuss their use, making these medications household names. The appeal is obvious: a simple, once-a-weekly injection that can help shed stubborn weight when traditional diets and exercise have failed. But like any medical treatment, the benefits must be weighed against the risks. These medications aren't magic. They can cause significant side effects, ranging from mild discomfort like nausea and bloating to serious medical complications such as pancreatitis, gallbladder disease, and kidney problems. According to clinical trials and patient reports, many people experience gastrointestinal discomfort that can be debilitating. In rare instances, patients have been hospitalized due to dehydration caused by severe vomiting. The longer-term effects of these treatments, still largely unknown. Another critical issue is access and equity. In many countries, these medications have become so popular for weight loss that supplies have been diverted away from patients who truly need them for managing their diabetes. In the United States and across Europe, rising demand has created shortages, putting people with type 2 diabetes in a precarious position. Meanwhile, the cost of these medications, often hundreds or even over $1,000 per month, means that only the wealthy can afford them, deepening existing health divides. Then there's the psychological component. We live in an era where body image pressure dominates social media, making many desperate for quick fixes. The rise of Ozempic and Wegovy taps into this vulnerability. Patients often achieve remarkable weight loss, only to regain it when the medication is stopped. The reality is that longer-term weight management still rests upon timeless principles of nutrition, regular activity, and behavioral change. Without a holistic approach, any weight loss may only be temporary. Medical experts across the globe emphasize that GLP-1 medications can be valuable tools when used appropriately. The evidence is strong that they can aid in significant weight loss and help reduce associated conditions like high blood pressure, fatty liver disease, and cardiovascular risk. However, these treatments must be administered under medical supervision and within a comprehensive program that includes nutrition counseling, psychological support, and ongoing medical monitoring. Moreover, medical authorities call for balanced narratives. The media often portrays GLP-1 drugs as an easy fix, a miracle shot with minimal effort required. But for patients relying on these treatments, reality is far more nuanced. They must grapple with side effects, adjust their lifestyles, and remain vigilant about longer-term impacts. Meanwhile, researchers continue to investigate the physiological and psychological effects of longer-term use. seeking to determine the safest path forward. It's also worth acknowledging the global implications. In the United States, the United Kingdom, and across Europe, rising obesity rates have created a crisis of chronic disease. GLP-1 treatments present an unprecedented opportunity for intervention. Yet, this trend also exposes deep systemic issues: access to quality care, the role of pharmaceutical marketing, and the urgent need for affordable treatments for every patient, regardless of income. In the end, medications like Ozempic, Wegovy, and Mounjaro are neither miracles nor demons. They are medical tools, potent, revolutionary, and potentially life-changing when used wisely. They can be a vital part of a comprehensive approach to tackling obesity and related illnesses. But like any medical treatment, their use demands understanding, responsibility, and respect for the complexity of human health. So, where do we go from here? The best path forward embraces both medical innovation and timeless wisdom. We must recognize that longer-term health is built not only on injections or prescriptions, but also on habits, mindset, and community support. Patients must be educated and empowered to make informed decisions, not just about a drug, but about their overall well-being. Meanwhile, medical authorities must strive to balance accessibility with safety, ensuring that no patient is left behind. As we stand at this pivotal moment in medical history, one thing is certain: the rise of GLP-1 medications has changed the conversation about weight loss and health forever. The questions we must now ask ourselves are profound. Will we use these advances to foster a more inclusive, holistic approach to health? Will we honor the complexity of the human body, and recognize that lasting change is rarely found in a single injection? Will we make these breakthroughs a bridge to better, more accessible healthcare for all? The answers to these questions will define how this chapter of medical progress is remembered for generations to come. Thank you for watching. Stay informed, stay hopeful, and remember, your health is worth more than any trend. If you found this video valuable, don't forget to like, share, and subscribe to Global Health Guide for more insightful stories about health and medical advances from around the world.